Welcome to Microexposure. In today's episode, I will be enlightening ladies on endometriosis. Also make you know that extreme pain during period is not always normal. Is your period pain normal? The truth about endometriosis. Every month, she cries in pain. Can't walk. Can't eat. Can't go to work. She was told, you are a woman, or pray harder, it's a spiritual attack. But what if it's not ordinary cramps? What if it's endometriosis, a hidden conditions affecting 1 in 10 women? What is endometriosis? Endometriosis happens when tissue that looks like the lining of the womb starts growing in the wrong places, like the ovaries, fallopian tubes, or even bladder. Each month, this tissue behaves like it's inside the womb. It bleeds, swells, and causes pain, but it has no way to leave the body. This leads to inflammation, swelling, and sometimes internal scars called adhesions. Symptoms women ignore. So how do you know it's more than just cramps? Look out for these symptoms. Severe period pain that stops your day. Pain during or after sex. Painful urination or bowel movement, especially during menstruation. Heavy bleeding. Bloating. Infertility. Constant tiredness. These symptoms are often ignored or dismissed. But your body is speaking. You need to listen. Real-life case. Benita's story. Benita is 27. Every month, her period knocks her out for 4 days. Her mum said it's normal. Her pastor prayed. One hospital said it was infection. It took 7 years before a gynecologist diagnosed her with stage 3 endometriosis. By then, her fallopian tubes were damaged. Now, she's trying IVF. Why diagnosis takes so long, especially in Nigeria? In many African cultures, women are taught to bear pain. Clinics may misdiagnose it as PID or fibroids. Some women even think it's a curse or spiritual problem. But endometriosis needs medical diagnosis, not just painkillers or prayers. How doctors diagnose it? Doctors may start with pelvic examination and ultrasound. But the only sure way to diagnose endometriosis is through laparoscopy, a small surgery that lets them see inside. It is not cheap, but it gives answers. Can endometriosis be treated? There's no permanent cure yet. But it can be managed. Treatments include painkillers like ibuprofen, hormonal therapy to stop your cycle, birth control, surgery to remove the growth, IVF for women struggling to conceive. What you should do now. If your period pain keeps you in bed, missing school or work, it's not normal. Speak to a qualified gynecologist. If one hospital doesn't take you seriously, seek a second opinion. Your pain is not imaginary. Your voice matters. Lifestyle tips that help. These steps won't cure it, but they help. Warm compress on your lower belly. Light exercise like stretching or walking. Reducing red meat, dairy, and sugar. Taking omega-3 or anti-inflammatory foods. Tracking your symptoms with a period app. Endometriosis is real. It's common. And it's painful, but many women suffer in silence. Thinking it's normal, don't be one of them. Talk to a doctor, ask questions, keep a record, and if you've been diagnosed, you're not alone. Subscribe to Microexposure for more health truths that could save lives. Don't forget to subscribe, like, and share.